Thanks. Thank you very much. Thanks for inviting me and the National Center for Health Statistics to be here today. What I'd like to do is to give you kind of the perspective on this from the standpoint of one federal statistical agency. I'm the former director, so the current director is not liable for anything I am about to say. But I think I have the thing pretty much right. I was there for 17 years. So, and this is a topic that was very much on the front burner for the agency over that period of time. We, of course, are one of many federal statistical agencies, and I think I'm speaking for the other federal statistical agencies as well. The other agencies are like, I think you know, the Census Bureau, the education statistics people, justice statistics, and the list goes on. There are many federal statistical agencies. There are about 13 that are the principal federal statistical agencies. So I always viewed that we had a set of prime directives at NCHS. I guess I'm a student of Star Trek, you could say. We're having prime directives. Some of you know what I'm talking about. Others, I'm sorry for you if you don't know what I'm talking about. But one is very clear. Our role is to provide information for policy and research, information about the healthcare system and about the health of people in this country as compared also with other countries. And that's spelled out very clearly in this section that I quote here of the Public Health Service Act. Okay? A second part of this prime directive is to assure and achieve widespread dissemination and access. It does no good to collect it, and we collect a wide variety of surveys. NHANES, I think you're familiar with many of these, the health interview survey. We coordinate and collate the births and deaths for the data on births and deaths for the country, information on healthcare through a variety of surveys. So all of that is extremely important, but if we put it in a safe, okay, it does absolutely no good at all. So the prime directive is really to conduct it and support these activities, okay, but also to get the information out. Well, then we have another prime directive, which is about confidentiality. And this really is one of the prime directives. And it's really clear. It prohibits the release of potentially identifiable data, okay? And this is under Section 308D of the Public Health Service Act. Other agencies have their own confidentiality legislation, but in general, over the last several years, it's been covered by the act we call CIPSI, the Confidentiality, Information Protection, and Statistical Efficiency Act. And this is serious stuff. It's serious in the sense that you can have a fine if you violate this, up to $250,000 or up to 5 years in prison. And I took this very personally. Okay? This is what it says under 308D, that no information identifying the person supplying the information may be released in any form without the consent of the person. I don't know what other form is doing there. Okay? So it's really clear. Now, on the distribution side, all the federal agencies go to great lengths to distribute their information through the public use data files, a variety of different publications. Essentially, all of those are on the web these days, a variety of data access tools. By linking the surveys one to the other, we have some very interesting things that we do along that line by reports such as the one in green here, which is the annual report of the Secretary called Health United States. This is the latest version, 2012, 2013. Will be due out in about 3 months or so. And we have another way, which was mentioned several times this morning, a research data center. Now, we're not the only federal statistical agency with a research data center. We may be the first, though. I think we were the first. They were the second, I'm told. But these days, we are not the only ones, okay? Now, let me just, all of us, I think, face fundamentally a balance between access to the information and the issue of preserving confidentiality. So I sort of view that as the need versus the law. And fundamental to this is the agency credibility. For if we break that, if someone breaks it, someone hacks it, to use the technical term, is that a technical term for this? Okay. Our credibility is really in jeopardy. Because when we go to any one of you and ask you to participate in the National Health and Nutrition Examination Survey, we make it clear, we pledge to you that that data will remain confidential. It'll only be used for research purposes, and you will be safeguarded. Now, there are a number of strategies that we use for sharing and disseminating the sensitive data. First of all, we create public use data sets which are as de-identified as we can make them. There's a state of the art. I wish there were a state of theoretical whatever, okay? Tanya could speak to that, I'm sure, but I wanted for 17 years a probability of disclosure. But we don't have probability of disclosures. We don't know what those probabilities are. So we try to do the best job we can and produce public use data sets that anybody can use, and that will safeguard the identity of the people who supplied the data. But we felt that we had to do more than that. So we created a research data center. We have strategies where people can come into the research data center. In Hyattsville, there's a new one in the Humphrey Building here in Washington, one in Atlanta. There's also, we partner with Census, so there are research data centers across the country. Or they can actually access the data remotely. There are other strategies as well, other enclaves. Newark has one, for example. There are other strategies. The National Center for Education Statistics licenses the use of the data. Okay? That's something that we have not, in NCHS, felt that we were not able to do because of our legislation. Part of that is the interpretation of the legislation, but for my 17 years, I absolutely agreed with that. So it's interesting, you have two federal statistical agencies doing taking different strategies. You can also rework the data sets and allow access in the data center or even outside the data center to rework data sets which are perturbed in some manner so as to preserve the identity of the respondents. Research data centers, these are ours and the Census research data centers around the country, and I want to just close on what I consider to be the unsolved or unresolved issues. One is this idea of estimating the probability of disclosure, and that doesn't mean picking one person and saying, can we find that person in the survey data? It means, in general, what's the probability that our data will be hacked? This is complicated by the mosaic problem. The mosaic problem, which I haven't heard mentioned today, but the mosaic problem is the fact that there are this semi-infinite set of data sets out there. And data in one can relate to another, which can relate to another, which can relate to another. And so you can start with some piece of information, relate that to a different data set, to another data set, and wind up, after you go through this sequence, being able to actually identify a person supplying data in that first data set. This is, I'm an analytic person, but this is very difficult to analyze in terms of understanding exactly what the risk is. The impact of disclosure came up several times in questions here, and there's impact on the individual, but from my viewpoint, it was impact on the agency and our ability to continue to function and to be able to collect information, very, very sensitive information, okay, and preserve that information. And finally, how does all of this relate to what the public expects? There's been some work on the part of the federal statistical agencies to understand what the public expectations are, but I don't think we have a very good handle on it. And our inconsistency between what we allow Safeway, Facebook, and you name it, to collect versus what it is we pledge to the respondents who tell us about all their former sexual partners, okay, is another story. Okay? Finally, okay, I think a key factor in all of this is no matter how much we vet people who use our research data center, there's a certain degree of trust that we must have in those individuals. Okay? So this is kind of the framework that I, as a director of one of these agencies, used in thinking about disclosure and the fact that we absolutely have to disseminate the information. But how do we balance that drive to disseminate versus our pledge to the respondents? Thank you.